Welcome to the August month of Board of Health Revere. Can you please stand for the Pledge of Allegiance? Welcome to the month of August 2025 City of Revere Board of Health public meeting. I am Dr. Drew Bunker, chairperson. With me to my left is Kathleen Savage, board member. To my right, Vivienne Catano, board member. And also to my left, Lauren Buck, who's the director of public health. Michael Wells, health agent, director of inspectional services. And Paula Sepulveda, board of health clerk. First, I'm going to ask the other board members if we can review and approve the minutes from the May meeting. Did they approve of those minutes?
I approve the minutes as written.
I approve as well.
Great, thank you so much. Next is the Public Health Communicable Monthly Report with Lauren. And then before that, we're going to do a presentation from the North Suffolk Public Health Collaborative from Vanessa Gordado Menjivar.
Hello. Will share my screen and let me know if you're able to see that. Are people able to see my screen at the moment? So, good evening, everyone. As it was said, my name is Vanessa. I am the regional epidemiologist for the North Suffolk Public Health Collaborative. For tonight, I'll be providing an update on the 25 community health assessment and what the progress has been so far. So just so they're all on the same page, when I talk about a community health assessment, we are essentially talking about a systemic way to pull together a full picture of a community health. It's looking at health status, the risk factors that lead to poor outcomes, and the resources that exist to improve health. This information is what is used to create a community health improvement plan, otherwise known as a SHIP. This is the long-term roadmap where we identify priorities and then work with municipalities, organizations, and residents to address them. Since 2019 for North Suffolk, we've been conducting them every 3 years, primarily just to make sure that the information is up to date and we're responding to changes that are going on. And most important, I do want to emphasize that we're not just collecting numbers. We are really trying to ensure that we're reaching populations that are often underrepresented, including residents most impacted by inequities, and using that as a guiding principle for this health assessment. So I have here is a timeline. We kicked things off in the fall of 2024, starting with collecting secondary data and engaging people. Through the winter and spring, we have collected feedback and we started reporting back preliminary findings. Right now, at the moment, we are at the stage of assessing the priority areas, and the update for today will be focusing on what we have identified and what the improvement plan will be. So since April, which is when I believe I presented last, I met with the steering committee in May to start talking about the data. This meeting was centered around what the focus should be, what the numbers are so far, and does it reflect the people we're experiencing on the ground. By mid-June, the survey officially closed. The focus groups and interviews were finalized around May, but we kept the survey open a bit longer, and that provided us with the final data set. For Revere specifically, we had about 450 respondents. Since the survey closed, I've been working on cleaning the data and completing descriptive analysis. And at the moment, we are currently on the second draft for the full report. So this will include the survey data, interviews, focus groups, and any findings in the narrative. In April, this was not part of the deliverable, but since then, we have actually added an ArcGIS story map. And this will be an online interactive tool where people can explore maps, charts, and multimedia to see the findings in a more engaging way. The main purpose for this is just to make the data more accessible, not just for professionals, but also for residents. So we're still on track and we're hoping to have the full report by early fall. For those who may not be so familiar with like a story map, since it is relatively new, the purpose of this is to really combine everything we've been looking at. So the maps, any interactive charts, photos, videos into one single narrative. Instead of having people flip through a static report, they can scroll through and actually explore the findings themselves. I'm hoping this will be really valuable just because it makes the data more approachable and transparent. For people who may not want to read a long report, they can still see what the findings are, why it matters, and they'll be able to zoom into specific data if they would like to. And as a note, the picture below is a mock-up. It's not the actual story map that is still in development, but it just kind of gives a sense of how it will look like. You'll be able to click on each individual square and it will lead you to a narrative. So for the survey, we had 450 respondents. I believe a conversation that came up previously was, how do we know if we have sampled enough people from a city? And for a population of about 62,000 residents, for it to be statistically representative, we need about 382 responses. So we did exceed that number. And that just means that we are able to generalize the data to the city. I do want to highlight on the table that compared to the census data, we did see stronger representation from groups that are often underrepresented in a survey. This was very intentional. We did a lot of outreach in person at events in order to get people who may not want to take an online survey. And you can kind of see this when we look at the Hispanic representation. We have 46% of Revere respondents identified as Hispanic compared to about 39% in the census. And we also had about 15% who identified as either Black or African American compared to the 4% that we see in the census. And this again was very intentional. For the most part, when we look at other assessments, they tend to be dominated by middle-aged white women. So we really try our best to get a broader perspective and just to make sure that we were both being statistically representative, but also inclusive and equitable about who we surveyed. So in Revere, there were 5 themes that came across in the North Suffolk in general, and these themes were housing. When we talk about housing, we are talking about the people's right for safety, affordable, and stable housing. This includes concerns with like overcrowding, high rent, and health impacts of poor housing conditions. Our next priority is behavioral and mental health. This is just including access to mental health, substance use service, ways to reduce stigma, and ways to support the community's well-being and their behavioral impacts. We have economic stability and mobility, and this is referring to the real ability to access jobs, childcare, have opportunities to move up a ladder, and allow them to meet their basic family needs. Fourth, we had environmental health, and this covers things like air quality, pollution, trash, pest, molds, and resilience to flooding and extreme heat. Those 4 priorities are the same ones that were previously identified in 2019 and 2022. We did add a new one this year, and that is access to care. When we refer to access to care, we are referring to the ability to get timely, affordable, and culturally competent medical, dental, and preventative service. So these 5 themes are what the assessment will be focused on. When we got this information, it was based on 2 main questions. One that was asking, what are improvements you want in your city? And what are the health concerns in your city. When we look at Revere specifically, we see that about 48% said they wanted more affordable housing, followed by better access to good job. When it comes to top like health concerns, 40 said some mental health, followed by housing at 34%. I can go into a bit more details about what this means specifically for Revere. The assessment itself will be a bit more broader and focused on North Suffolk. But when we look at local data, 32% of survey respondents reported difficulty paying for rent, mortgage. Nearly 48% identify affordable housing as a top concern. And when we compare these to North Suffolk numbers overall, Revere shows slightly higher rates of housing instability. From focus groups and interviews, people mentioned that it was hard to keep up with rent. We heard from longtime residents who are frustrated about the rising costs, pushing families out of the city. And community leaders noted that younger adults often need to share housing just to be able to stay in Revere. I will emphasize that this is a concern that's not just in Revere. We saw similar things in Winthrop and Chelsea. It is a concern since we do know that it directly linked to health. It creates chronic stress, impacts mental health, and raises the risk of eviction-related displacement. We know that unsafe housing conditions like pest, mold, or poor air circulation also contributes to respiratory illnesses like asthma. When we look at environmental health, we saw that nearly 40% of Revere respondents identified environmental health issues, and this included air quality from like the airport, traffic pollution, trash, flooding. There are several neighborhoods in Revere that are FEMA flood zone, which just means they're vulnerable to this 100-year storm event. And on top of that, the tree canopy is lower than the state average. What we heard from the focus groups and interviews were that some residents felt that the flooding kept getting worse every year. People again were talking about lack of safe green spaces, and seniors in particular voiced concern about extreme heat and the lack of shaded areas in the city. The connection with the health it's related with worsened asthma and cardiovascular diseases. Flooding and extreme weather events increase the risk of injury, displacement, and strain on mental health. This summer, I believe that 2 weeks ago was the first week we did not have an unhealthy heat alert. So we are seeing more extreme weather when it comes to heat, but also winter. When it comes to behavioral and mental health, this has been one of the top priorities in every single assessment conducted. More than half of people selected this one. It was also selected that about 32% of people said that the community's mental health is either fair or poor. And when we looked at the data a bit deeper, people who selected between the ages of 18 and 34 were more likely to report stress, anxiety, and depression. This mimics what we saw with the interviews and focus groups. There are too many barriers to finding a therapist. Wait lines are long, and providers also flagged new challenges. Specifically, one that came up was gambling among older adults, and the focus groups consistently brought up social isolations. For the health connections, besides just worsening chronic diseases, it can increase substance use, lower overall quality of life. And for seniors, the social isolation is especially dangerous since it's strongly associated with higher rates of depression and even premature mortality. For economic stability and mobility, about 12.4% of Revere residents live below the federal poverty line. At the same time, when we looked at the status for employment from the health assessment, About 13 reported being unemployed at the time they took the survey. Food insecurities remained a concern, which did not show up in previous assessments, but was really high for this one. It mimics for what we saw with the interviews where people say they want to stay in Revere, but there aren't enough jobs that pay enough to stay. Younger people also share that they often have to travel outside of Revere, not just for work, but also for social opportunities, just because they feel like they had limited local options. Again, everything is interconnected here. When we talk about economic instability, it ripples into other areas we already discussed, such as with the food insecurity, the housing instability, and reduced healthcare access. It can contribute to mental health challenges and just overall poor physical health outcomes. The last one, which is a new priority we identified, was access to care. And for this one, about 23% of Revere respondents reported difficulty access care in the past year. There were many barriers that came up, but the top included language access, transportation, and affordability. We also saw that those without insurance who felt comfortable reporting that were less likely to use preventative care. From the focus groups, they mentioned they had a hard time finding doctors who spoke their language or understood their culture. Besides the long wait again, it would very similar mimic the survey for transportation issues and among seniors specifically, having issues to getting to their location when they don't have a car. And we know that a lack of preventative care increases the risk of unmanaged chronic disease. We're talking about diabetes, hypertension, and cancer specifically, which tend to disproportionately affect immigrants and low-income residents. So from these findings, we are again going to focus more on North Suffolk in general for the assessment. I just pulled out Revere facts specifically, but we are in the process of stratifying the data. Right now, we have the aggregated data for all three, but this data will be stratified by age, race, ethnicity, and gender. The interactive story map will be coming out this fall. It will have a full list of indicators and code book if people are interested in looking at all the questions we ask. And the report will still be coming in 2025. The draft is being finalized sometime this week or next week and is being sent out to the steering committee to review for feedback for the next month before the final version comes out. I don't think anyone here is on the steering committee, but if you are interested in looking at the draft before fully being released, I am more than happy to send you the draft, get feedback on what is on there. And later this fall, closer to winter, if there's an interest to look at the indicators more closely and look at rates among different factors, that is something I'm more than happy to talk about. The example I have here is just whether residents who report food insecurity are also more likely to report barriers to care or poor mental health. There's a lot we could do with the data, so I'm always happy to meet and talk about that. And if there's any questions, I can answer them now, but I'm also putting my contact information if anything else comes up. And that is what I have for the health assessment today.
Great, thank you so much, Vanessa. If you guys have any questions, board members, or, yep, please.
I just have one question. I want to know how Revere rates, I guess is a good way to say it, between the other local communities. How do the numbers rate?
Rate as in total respondents or?
Or just comparing outcomes, I think that's what
yeah.
Kathy was,
Yes.
yeah, just like the different outcomes that you went through.
Yes, so
How we match
Chelsea-
up.
So for Chelsea and Revere, they were pretty similar. For Winthrop, most of the findings were about seniors and elderly, so their population demographic is a bit different. Chelsea and Revere were pretty close when it came to all the findings.
Thank you.
Great, thank you so much. I don't think there's any further questions, but we'll look forward to following up on this and seeing where this goes. And this information is incredibly useful for a lot of reasons and for the health of this community. So thank you. Next is the Public Health Communicable Monthly Report. It's going to be with Lauren Buck.
Thanks, Dr. Bunker. Bear with me. This report is a little bit longer just because we've had a couple of months off from our Board of Health meetings. First up, our Communicable Disease Monthly Report. You'll see in your chart that we had quite a few cases of COVID, 362 confirmed cases and 108 probable cases of COVID over a 3-month period from the end of May until today. This does correspond with national trends that show a bit of a wave in the summer months for COVID, so it's not different from national trends. I'll also point out we had 8 cases of salmonella. There have been recent, in the area, some recent increases of salmonella. This is not an outstanding number for us, however. And I'll just also point out very low cases of influenza, but we expect those numbers to rise in the fall as every fall we have a bit of an uptick in respiratory illnesses. And then moving on to our state and national public health updates. I pulled most of these updates from a new resource. It's Caitlin Jetelina is a former CDC trained epidemiologist, and she runs a epidemiological news feed for a lot of public health resources, and so I pulled a lot of this data from her. So I'm going to update you on some COVID things about the trends nationally, the vaccine, just a very quick update about the measles outbreaks that were happening in the West, and an update on the bird flu. So first of all, COVID-19 rates continue to climb nationwide. Like I mentioned, there usually are some summer surges. So nationally, emergency department visits are still lower than this time last year, but the U.S. is on track to surpass the peak of last winter's wave. Currently, the age group with the highest rate of hospitalization are kids under 18 years old, and this pattern is consistent with previous years when the return to school creates more opportunities for the virus to spread. So speaking of COVID-19, there's been a lot of news recently about the COVID-19 vaccine. I pulled this from Caitlin, the latest information that Caitlin updated yesterday. So yesterday, the CDC announced that the COVID-19 vaccine is ready for use, but it has limited the recommended use to people over 65 and those between 16 and 64 years old with at least one condition that puts them at high risk for severe outcomes from COVID-19 disease. So typically, those are people who have comorbidities, things like heart disease, lung disease, things like that. Confusingly, the American Academy of Pediatrics recommends that all children under 2 get vaccinated, as well as high-risk children and those living with someone who is high-risk themselves. The American College of Obstetrics and Gynecologists published guidance that recommends pregnant women receive the vaccine at any point during pregnancy, when planning to become pregnant, in postpartum, or while lactating. In general, the science really hasn't changed that much around the vaccine, but the vaccine is still very safe and effective, but what has changed is the environment. Most of us now have some level of immunity, which is why COVID-19 is no longer an emergency or an epidemic or a pandemic. Immunity has 2 layers. It's the short-term antibodies and the long-term memory cells. COVID-19 antibodies fade within about 4 months, so you're more likely to get infected if you haven't had a recent vaccine or have recently had an infection, but memory cells last longer and help prevent severe illness. These don't seem to fade for healthy or young individuals, but not everyone's immune system holds on to protection equally well. Not everyone's young or healthy. That's why high-risk groups are prioritized for ongoing vaccinations: pregnant women, children under 2, adults over 65, and those with chronic conditions. Next up, measles. So measles cases continue to pop up sporadically across the country, but the West Texas and Kansas outbreaks are officially over according to CDC guidelines. And finally, an update on the bird flu. News on the bird flu has also been relatively quiet over the last few months. The USDA continues to randomly find bird flu in wild animals, but the risk to the general public remains extremely low. And then finally, I would be remiss if I didn't talk about a lot of the updates that are happening within our own public health department and within Revere. So I want to brief you on 4 upcoming programs that we are very excited about. First of all, in partnership with the Revere Fire Department, the Public Health Department is bringing fire prevention awareness to Revere during a new elongated Fire Prevention Week program. So be on the lookout for PSAs on Revere TV over the month of September with information about fire prevention and safety. Consider attending the Revere Fire Open House on Saturday, October 11th from 11 to 2 at Central Fire Station, which is 400 Broadway. Food, giveaways, fire truck demonstrations, all in an effort to make sure that Revere is more knowledgeable about fire prevention and fire safety. Secondly, on Friday, September 5th, the Community Liaison Office is hosting their 2nd annual Resource Day in the City Hall parking lot from 12:30 to 2. Anyone is welcome to come by, interact with over 30 different community service agencies, and enter raffles. We have giveaways for gift cards. It's a really great event in the City Hall parking lot, designed to help people connect with resources that they might not know about. So again, over 30 different agencies will be coming. Chances are, if you have a question about how to get services, the agency that you will need to get those services will be at our event. Thirdly, the Substance Use and Homelessness Initiative's office, the SUDI office, will be hosting their 2nd annual Shame on Stigma event on Saturday, September 13th from 2 to 5. You can stop by. There's going to be a dunk tank, a barbecue, free food, resource tables. The event really aims to help decrease the stigma surrounding the substance use community and reduce the shame often felt by people looking for help in their recovery journey. It's a fantastic event. There'll be speakers. I encourage everyone to come along. Free food, lots of good, fun stuff. Again, that's Saturday, September 13th from 2 to 5. And finally, our annual Public Health Department flu and fall respiratory vaccine program is just starting out. Couple of different options. If you're looking for you or a loved one that is homebound and struggles to receive vaccines, especially the fall respiratory vaccines, at a pharmacy or a doctor's office setting, please call our office, the Public Health Office, at 781-485-8486. We are going to be doing an in-home vaccination program again this year. We do it every year, but this year, excitingly, we'll be able to offer flu, COVID, and pneumonia vaccines to our homebound residents in Revere and their caregivers. You would receive a vaccine from a public health nurse, such as myself, or the 2 other public health nurses that work in Revere. We offer vaccines to senior buildings, including the senior center. You can call our office for the schedule, but you can also look to those buildings and those to the buildings for the dates that we will be at those buildings to offer high-dose flu and regular flu if you're interested. And then finally, we will be offering flu vaccines every Wednesday from 3 to 5 in our public health office at City Hall starting on September 17th. So a lot of different options. We're expanding our homebound program this year, which is really exciting. You can always call our office if you have any questions. And that's it.
Great. Thanks, Lauren. Next is the Inspectional Services Monthly Report with Michael Wells.
Thank you, Dr. Bunker. Monthly report for inspectional services for the month of August. On the Interior Housing Division, we performed 128 certificates of fitness, 20 re-inspections on certificate of fitness. Interior complaint new, 3. In interior complaint in process, we have 5. And we performed 2 pool inspections. On the Food Inspection Division, 32 routine inspections, 5 re-inspections, 4 complaint inspections, 2 pre-opening inspections, and 2 temporary food service inspections. On the Exterior Sanitation Division, total trash violations issued was 403. Carts out at improper time was 1. Overflowing dumpsters was 61. Commercial vehicles in residential neighborhoods, 2. Junk heaps and automobile graveyards, 25 violations, 5 violations for multiple unregistered vehicles on a property, and 3 violations for rodent harborage. Unclean, unsanitary land, which is considered overgrowth, 121 violations, and 2 violations for unsafe structure. That concludes the monthly report for inspectional services.
Great, thank you. Next is going to be the license of the body art and chicken keeping. Have Lauren go ahead with that.
Thank you. We have 2 licenses up for approval tonight. I'll start with the body art. So we have a body art individual practitioner application submitted by Tice Merlin. She will be practicing in the same location as Connection Beauty Spa, which is a previous establishment license. So this will just be for her individual practitioner application. She submitted her application in July. Her inspection date was August 20th. She did pass, and so we recommend that you approve the license for this individual practitioner.
Great. I'm going to ask the board members if they approve.
I approve it as well.
Okay, I approve as well. That's 3 for 3.
Awesome. Last up is our chicken keeping license. So we have, oh, and I apologize, the body art establishment location is 91 Hutchinson Street. Our chicken keeping license is from Joseph DeCenso at 64 Crescent Ave. His submission for his application was in July. We have inspected twice. We did our reinspection earlier this morning. Joseph has 3 chickens and had to work on making sure his feed and bedding was in a rodent-proof container. His compost was in a rodent-proof container, and he did make those adjustments on his second inspection. He had to adjust the size of his coop and run structure to make them bigger. Our regulations state you need 10 square feet per chicken, so he needed a total of 30 square feet, and so he was able to do that. There is still a few minor things that he needs to work on, but nothing that would prevent his license from being approved. So I recommend that you approve his license for the chicken keeping at 64 Crescent Ave.
I approve it as,
I approve as well.
Me as well. That's 3 for 3. Excellent. Is that it? Great. Well, that will conclude this month's meeting. Thank you.